Hello, my name is Shrusti Singh and I'm a research intern at Nikore Associates. Welcome to another video in our Budget Explainer series where we delve into different aspects of the Union Budget 2022-23. This video would specially focus on the health and well-being expenditure in this year's Union Budget, which was 1,75,000 crore rupees. Now, when you look at this number carefully, it is only a marginal increase of less than 0.5% from last year's revised estimates, which is the money that the government actually ended up spending towards healthcare in the last fiscal year. Now, the allocation made towards this healthcare budget actually goes to three different ministries, which are the Ministry of Health and Family Welfare, the Ministry of Jal Shakti, and the Ministry of Ayush. Now, as we move along in this video, we would also be looking at the allocations towards a few of schemes under these specific ministries. Now, since this budget is the second union budget since the onset of the COVID pandemic, it is important to look at the allocations made towards tackling the same. The expenditure for COVID-19 vaccination has actually been decreased significantly and received an allocation of only 5,000 crore rupees this year. But it is also interesting to note that the budget allocations for the development of health infrastructure across country at all levels of healthcare received increased allocations from last year. The Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, which focuses on developing health infrastructure at all levels of healthcare pan-India, received an allocation of 4,176 crore rupees as against only 585 crore rupees last year. The other major increase comes from the Ministry of Jal Shakti, wherein the Jal Jeevan Mission, which aims at providing functional household tap connection to every rural household by 2024, received an increased allocation of 60,000 crore rupees, which was up by 33% from last year's allocation. Also, the National Ganga Plan under the Namami Gange Mission 2 received an allocation of 2,800 crore rupees for rehabilitation and upgradation of existing sewerage treatment plants around Ganga and its tributaries. Now, keeping in mind the role of technology in expanding the access of health and medical care across the country, two key digital schemes were announced by the Finance Minister Nirmala Sitharaman in her budget speech this year. The first one was the rollout of a national tele-mental health program under which a network of 23 tele-mental health centers of excellence will be rolled out. The second one was the rollout of the national digital health ecosystem, which would lead to the development of one integrated and standardized platform within the expanding digital health ecosystem. This would include digitizing your health and medical history, enabling smooth digital online transactions with healthcare providers, and the creation of a unique health identity and consent framework within the health ecosystem. The allocations for the National Digital Health Mission, which would involve creation of this national digital health ecosystem, was increased by a whopping 167% from last year. So this was our attempt at breaking down the major components of this year's health and well-being expenditure basket. So we would like for you to take care of your health and mental well-being. Thank you so much for joining us. Stay safe and stay healthy.